Hello and welcome to all, and thank you for joining us today. Today is April 7th, 2016, and this is Hangouts with HIVE. Our Hangout on air today is Making PrEP Work for Youth, Strategies from Birmingham, New York, Oakland, Philadelphia, and San Francisco. My name is Yamini Oseguera-Bhatnagar, and I'm the Power Health Coordinator at HIVE, which is a hub for positive reproductive and sexual health, and I'm participating in this Hangout live from San Francisco. A couple of housekeeping items before we delve into the content of the hour. We will broadcast for the next 60 minutes. During this time, as you listen to our panelists, please think about questions that you may have and type them into the Q&A box on the bottom right corner of your Hangout screen. Note that you'll need to sign in to Google Plus to be able to do this. Alternatively, you can also post your questions and comments on Twitter using the hashtag PrEP4Youth. If you have questions and want to use Twitter, please go ahead and use the hashtag PrEP4Youth. We're doing this Hangout today in honor of National Youth HIV/AIDS Awareness Day. So show your love by using the hashtag NYHAAD. Again, that's hashtag NYHAAD, National Youth HIV/AIDS Awareness Day. And National Youth HIV/AIDS Awareness Day is in solidarity with young people living with and affected by HIV. And we always love to shout out our very own location-responsive, searchable California PrEP directory, Please Prep Me, hashtag Please Prep Me, and you can also find us on pleaseprepme.org. If you missed the live broadcast and are watching the video of this Hangout after the fact, you can click on the beginning or ending slide to be directed to a list of resources relating to this Hangout. Today, I'm joined by colleagues from all over the country, and I'd like to go ahead and introduce you to them. We will start with Caitlyn Cunningham, who is the Director of PrEP Programs at Philadelphia FIGHT. She has been working in a community health setting to provide PrEP to youth and marginalized communities since 2013 and is deeply, deeply committed to reducing barriers to PrEP access and care. Caitlyn, welcome, and thank you for being with us. Brian Ragas is a longtime advocate for safer sexual health and wellness with a long history of working with communities of color in the Bay Area. Brian is currently the Outreach and Linkage Coordinator with CRUSH, which is Connecting Resources for Urban Sexual Health, primarily working with men who have sex with men in Oakland, supporting access to sexual health services like PrEP, PEP, and STI screening. Brian, welcome, and thanks for being with us. Cory Belkind is the Clinical Director of the Health Outreach to Teens program, HOT program, at Callen Lorde Community Health Center. He is a pediatrician and adolescent medicine specialist who is passionate about healthcare for young LGBTQ patients and youth living with or at risk for HIV. Thank you for being with us, Cory. Kachina Kudroff earned her Master's of Public Health from the University of Alabama at Birmingham, where she now works as a coordinator of health education at the 1917 HIV clinic. In her position, she manages the PrEP clinic as well as the sexual health awareness through peer education or SHAPE program, which serves youth and young adults in the Birmingham area. Kachina, thank you for being with us. Adam Leonard is a nurse practitioner with the San Francisco Department of Public Health, specializing in adolescent and young adult health. He works in the department's Community Health Programs for Youth, or CHIPPY, clinics, caring for 12 to 24-year-olds, and has been leading efforts within those clinics to expand PrEP access to youth across the department's 10 youth clinics. Shannon Weber is the Director of HIVE, founder of PleasePrepMe.org, and the coordinator of San Francisco's Getting to Zero initiative. And Shannon has graciously agreed to help us with our Q&A session today. Thank you, Shannon. Last but certainly not least, we are joined by Malaysia. Hi, Malaysia, who is a part of the Youth Health Empowerment Project at Philadelphia Fight, and will be talking to us today about what it's like to be part of the leadership team there. Thanks for joining us, Malaysia. And also Alexander, who is a student at University of the Arts and is majoring in music business. Alexander is going to talk to us about their experience with programs at Philadelphia Fight. Thank you all for being with us today. Now, a little bit about HIVE. HIVE was founded in 1989, HIVE, which is formerly BAPAC, is the umbrella organization that encompasses clinical care, training, advocacy, and a virtual hub for disseminating best practices for comprehensive HIV-informed reproductive and sexual health care. Our mission is advancing reproductive and sexual wellness for individuals, families, and communities affected by HIV in San Francisco and beyond. Our vision is to see a world where people affected by HIV have safe pregnancies, reproductive autonomy, access to state-of-the-art health care, and enjoyable sex lives. So why youth? Let's talk really quickly about that. According to the CDC's data from 2010, it's old data, but it's all we have for now, youth aged 13 to 24 accounted for 26% of all new HIV infections in the United States. In the same time period, young men were the only age group that showed a significant increase in new infections, up 22% from 2008 to 2010. Over a 2-year period, there was a 22% increase. Young people of color accounted for about 80% of all new HIV infections among youth in the United States. Now, why PrEP? PrEP has shown itself to be a promising tool in the HIV prevention toolbox, and along with PEP and condoms and STI and HIV testing and behavioral interventions, has the ability to slow the number of new infections. So why youth and PrEP? Youth-focused programming for PrEP access is essential to begin to address the gaps in uptake given the high incidence among youth. Young men who have sex with men and youth of color are at substantial HIV risk and must have better accessibility to an expanded HIV prevention toolkit, including PrEP. There are real barriers in providing PrEP to youth. Some of them are coverage options for PrEP that continue to be a challenge for adults and youth, confidentiality issues that come up for youth when using a parent or guardian's insurance, for example, the fact that PrEP is not approved for those under 18 or included in any national guidelines. There's questions about adherence for youth. And there is a need for best practices for serving youth, including outreach. A youth-centered, culturally competent approach to HIV prevention is needed to identify the path forward for true access for young people. And with this understanding, we reached out to innovators and leaders in the field of youth and PrEP to form this panel today, so we might be able to illuminate the path forward and to identify emerging best practices that might be rapidly scaled as new PrEP and HIV prevention opportunities emerge nationwide. And with that said, I'd like to hand over the mic to Caitlyn to tell us the Philadelphia story.
Thank you so much, and thank you for hosting this super important Google Hangout today. I'm really grateful to be here with everyone. So a little bit about where I'm talking from today. I'm from Philadelphia Fight, and we are a program that has a youth health center that works with young folks ages 13 to 30 around PrEP access, and we have some other health centers that also can support folks that are older than that who are looking to access PrEP. But one of the things that I think is really important that I'm going to kind of situate my entire kind of conversation around is I think that fundamentally from the start of where we built our program out of, and that was kind of back, we kind of built our PrEP program out of FDA approval in 2012 and kind of looked not as prescribing PrEP, but really building a comprehensive program. And I think that's really important. So PrEP isn't a prescription that we write to folks. It's a comprehensive program that you can access if you feel like you need a lot of other things, and I'll talk about that. But it was built around the fact that we are committed to believing that young people can take PrEP. And so I really want to like situate what I'm going to say around that, because I think that that is something that's perhaps not part of the national discourse around PrEP. I think that there's a conversation that's happening around PrEP or adjacent to PrEP where it's that young people can't take PrEP or young people can't be adherent to PrEP. And I think that I want to fundamentally say that I think that young people are amazing agents in their own health. And I think that young people can take PrEP and do take PrEP and are just brilliant in doing that, and we're going to hear from two incredible folks later. And so I want to say that I think that that's really important when we're thinking about how to provide PrEP competently to young people and in a youth-centered way. I think the fundamental jumping off point is to know that young people know what they need in their health care. And that as healthcare providers, how can we facilitate that, right? And so that's kind of where I want to start. So at Philadelphia Fight, I think that there is a few components to our health and PrEP program that are kind of, I think, key to the success of our PrEP program. And I think one of those is the ways in which we provide medication adherence support to our young folks. And again, I think that it's that folks can come and access PrEP. And so, right, so before I get into adherence, right, we know PrEP only works if you take it, and I'm going to take it a step back, and that PrEP only works if you have the access to take it. So before we can start talking about adherence to PrEP, we need to talk about, do folks even have the bottle of meds to start taking it? Can we even start talking about medication adherence? Because the complications of filling a script are questions 1, 2, and 3 before we can even start talking about what are going to be some of the unique situations that we may need to discuss around medication adherence. And so I think one of the things that we're really committed to in our clinic is that we complete all of the paperwork for every single person coming into clinic. So whether it be dealing with the private insurances, whether it be dealing with the Gilead Medication Assistance Program, whether it be completing the Gilead copay cards, we're completing all of that paperwork for every single one of our clients. And I think that's fundamentally important to the success of people accessing medication, because it's frustrating. I don't want to do this for my own medications, right? And so I think that in order to successfully make sure people have the access to the medications that they want to take, we need to figure out how can we be facilitators to that. Because I think that as healthcare providers, when we look at, we have hundreds of patients on PrEP, right? Each of us probably collectively. It makes it really easy for us to then call Gilead and say we need X, Y, and Z for our patients, or call XYZ private plan and get that done. Whereas for each individual client, it's a new situation, right? So we can use our resources and kind of put that together. I think the second step is then adherence questions, right? How can we then say what's going to work best? And I think that's a question for each individual person that we really need to say it's not a one-size-fits-all model. It's a really like each individual person needs to be having that conversation with someone in the office. And it doesn't necessarily need to be a provider. It can be an MA. It can be an adherence person. We have a fantastic PrEP retention person, Devin, and she is a rock star. And so Devin meets with folks that come in, and you know, it can be one-on-one conversations, but folks have the option to come into clinic weekly, monthly, bi-weekly, every other week, or can kind of go with a more traditional prescription model, which is getting a script every 3 months. Very few people opt into that. Most of our folks want to come see us weekly or want to come see us monthly, and I think that's kind of a testament to what other things are going on and what other things can YHEP support folks with. So we have a comprehensive drop-in that also may address some other things that are going on in folks' lives. So it's a place that offers food, clothing, showers, other health care, so primary care. So you can come and have a sick visit, and you can also get your PrEP. And so I think those are things that are really important to say, what other things are going on in the lives of young people, and what other things can your PrEP program address, and how can that kind of be a part of adherence, right? Because I think that those are really important. And when we talk about medication adherence, if folks are experiencing homelessness or housing insecurity and they have a 30-day supply of meds, that can be really tricky if we know we can't get an additional 30 days if meds get stolen or meds get lost. And the last thing I'll say is that, you know, what we know in our clinic is that young people can and do take their PrEP really successfully. In a sub-study that we have going on, we see adherence rates of 70 to 80% of high adherence in using a urine tenofovir assay that we developed. So we know that young people are amazing at taking PrEP, and I think it's about, like, in what context are you prescribing PrEP? And I think if you say, here's a prescription to PrEP, see you in 3 months, you know, like across the board nationally, it's not unique to young people. Like, all folks really struggle with medication adherence. And so I think if we blame young people, or if we don't celebrate the strengths of young people, it can be really problematic. And I think we can say, like, with the right supports and with a really strength-based approach to saying, like, what can we do to support you, and how can we support you? Like, we're on team you. You know, that is a really successful model for delivering PrEP, and I think that that's something that we can all say, how can we be better at supporting young people, and really something that that works. And I think that each of us on this webinar, and people that are not on this webinar who do work with young people, can say it works, right? And I think that that's really important. And I'm so excited to hear from Malaysia, and so excited to hear from Alexander, because I think they're the, like, true heroes in all of this, right? Like, folks that are advocates for their own health, and folks that are, like, doing such brave things, like being in the world telling their story. And so I'm just super excited about that. So thank you so much.
Thank you, Caitlyn. Philly is putting it down. Thank you for really grounding us in the fact that we must love our young people, and we must really care about our young people. Thank you for telling us that young people are amazing agents in their own health. We need to hear that, and we need to work from a place where we start with that idea. I'm really loving the comprehensive drop-in options, the weekly, monthly, quarterly, and we would love to hear more eventually about your sub-study and about the fact that young people are taking PrEP, they can take PrEP, and they are doing a great job with adherence. This is something we need to definitely hear about. Thank you so much for that. Really quickly, if you have questions, you can type them in the box on the corner, or you can use the hashtag PrEP4Youth. You can also show us some love for National Youth HIV/AIDS Awareness Day by using the hashtag NYHAAD, and show some love for Please Prep Me. With that, I'd like to turn it over to Brian to tell us the Oakland story.
Hi, how y'all doing? Great, and thanks for having me here. This is really great, and again, really important to talk about because, you know, here in Oakland, we are doing a lot too, and we'd love to definitely have the opportunity to share with you all what we're doing. So for those of you out there, Crush is located in Oakland, California. It's just east of San Francisco in a part called Alameda County. Historically, Oakland has been home to like many working class and low-income people of color, particularly African Americans. But recently, we've really seen a shift in that due to a lot of things like displacement and gentrification. But similarly, HIV in Alameda has really disproportionately really impacted African American community as well, particularly African American men who have sex with men. So even with the epidemic severely hitting our community, we really didn't have many resources here. For example, Alameda County, there is no public or municipal, publicly supported HIV or STD clinic. So out of that, CRUSH grew out of what's called the Downtown Youth Clinic here inside the East Bay AIDS Center. And so that began in 1997, and the DYC is primarily an HIV positive youth place, or services for HIV positive youth who see like 18 to 29-year-olds. So partly based on that model, CRUSH was launched in 2013 really as a demonstration research project to really understanding the best practices for providing comprehensive sexual health services for MSM of color and improving their routine and getting them things like PrEP, PEP, and HIV and STD testing. So CRUSH serves primarily MSM transgendered folks between the ages of 18 to 29-year-olds, as well as those who are serodiscordant relationships who live here in Oakland and the greater East Bay. And currently, EBAC is also, the East Bay AIDS Center is also expanding CRUSH-like services for those outside of that criteria that I just mentioned. So we started offering PrEP to youth at no cost, provided they consent to be part of our study. At the time, recruitment was kind of slow. We think because PrEP was just becoming FDA approved, and there were still a lot of questions, misinformation, and stigma around the drug. This was a time where there was terms like Truvado whore going around, and it was really seen kind of seen as a party drug. But added to the fact that PrEP requires getting so much clinical follow-up, that for working class men of color, that the process of getting into the clinic was really challenging. Partly because of distrust of the medical system, but also there's like a really lack of awareness that these type of services exist. So, but even with these challenges, CRUSH over time gradually started to see an increase of numbers with young MSM seeking PrEP. Through education and the partnerships with our community organizations, really the narrative around sexual health began to shift, and young MSM of color began seeing the benefit of what's it to be on PrEP. Offering them to them with no pressure and having them realize it's just part of the continuum of care. So it's just, it's just one thing that we offer, and that many of our folks actually don't go on PrEP right away once they come in here. They seek other health sexual services, and over the time, and they're part of them being in this project, they make the choice for themselves to really be on PrEP or not. What really worked for us is really just that patient referral system. They tapped into their own social networks. After patients came in and starting to feel comfortable with our services, and the people here, they started just telling their friends, and they said that PrEP, they see the benefits of PrEP is really working, and that it's just keeping them safe as an added extra protection. Another huge factor for us is getting folks is our community advisory board, who serves as community ambassadors. So these are the folks really gatekeepers in our community, who serve a part of our board and really went above and beyond to help us get people into our program. Another key challenge that we kind of addressed was also the retention factor, and we all know adherence is kind of tough. Like I said, folks getting them in, but we also have an amazing retention coordinator who works really diligently to keep in contact with folks. He's constantly communicating with them via text and any means possible to really meet them where they're at, and to get them really into the clinic. And so then when youth do come through the door, they're really welcomed with folks who are representative of the communities that they're from. So there's people that look like them, and there's providers here that provide really their services in a non-judgmental space. So they make them feel really, really comfortable when they come in here. And then again, I think what's really important and what's really a key success for us is, again, our community advisory board. They have been really instrumental into really what's defining and showing us direction into how to provide services for the community. And so we have a really robust group of young folks who we meet like once a month and really tell us how it is like on the ground in the community. But much more than that, then our CAB is really also a space, like a learning space, where we provide education and learning opportunities, and at the same time our CAB really assists us in some of the programmatic implementation. So they really sit in our research meetings. They serve as like media points, and they do like a lot of work. They do a lot of work for us, giving us that that on the ground perspective. So yeah, I'd just like to say that, and that's been working really well for us.
Awesome. Thank you so much, Brian. I have had the privilege to be around some of your CAB members, and I have to say that they are really amazing group of people. And thank you for talking about how they've been instrumental in Crush's work. And also appreciate you talking about your staff and how important really it is to have staff that is competent in working with young people. Thank you so much, Brian, for bringing Oakland. Next, we're going to hear from Ori for the New York story.
Thank you, and thank you for inviting Callen, Lorde, and Hot to be a part of this great hangout. We don't get to hang out a lot, so this is very cool. So our PrEP services started really a little bit as an extension of what we were doing in the adult program. The adult program starting offering PrEP before we did in our youth program. Our youth program sees patients from 13 to 24. And once we saw the success that the adult program was having, we realized that it was something that we definitely needed to offer to our youth, that our youth needed it, wanted it, and were ready for it. And so we just adapted it to the wraparound services that we offer. We've had some success with our program. We have started a significant number of patients on PrEP. We still have challenges because the patients on PrEP are not representative of our whole population. And I think that's what a lot of us are seeing, that we might have a largely black, we have a significant trans population, and that's not being reflected in the numbers in the distribution of our PrEP patients. And so that's where we're focusing our efforts right now. The way our program works, patients meet with a case manager. We have a strong case management team that meets with the patients, does a psychosocial assessment, gets an idea of what the patient services needs. We have a much easier access to medical services for PrEP patients. They don't have the usual wait times that some of our patients face, because we feel that this is something that needs to be addressed when motivation is at its peak, and it might be either a patient that came for test for something that they're worried about. We do a significant number of what we call PEP to PrEP, where patients come in to access PEP, and then we try to link them so that they can continue on to PrEP once their PEP is over. Our referral sources, our internal referral sources, they can come from our prevention and outreach team that does testing, from self-referrals from our sexual health program, or even some of our own hot patients. We also have a mobile medical unit, or a hot van, that goes to different sites, and one of our newest projects has been mobile PrEP, where essentially we go to different sites and we're trying to start patients on PrEP. This has been particularly successful at the Staten Island Pride Center. Staten Island doesn't have a lot of services, unfortunately, and so we saw that there was a great opportunity for us to offer these services, and our PrEP services are definitely being taken advantage of, and they have been welcomed. We also have Monday night Vogue nights, where we've partnered with members of the Vogue community, We do STI testing and screening outside a Monday night event that is well attended. We provide incentives for people that get tested. We do referrals for PrEP, and we've also hosted balls that have a PrEP theme. And so, you know, we've hosted the events that's PrEP theme, and so the costumes, the overall theme, and so they have been great educational opportunities for a community that has traditionally been hard to reach. Right now, our focus in clinic is to educate and offer these services to our trans population. We know that our trans population might face significant barriers to access care. We know that HIV prevention might be low in their list of priorities sometimes, and so we're trying to raise awareness of the existence of this amazing tool and the accessibility and how accessible it is. We have in the clinic at large, in the community health center, we have a PrEP team, 3 or 4 members with a PrEP team that help patients complete application forms. In New York, we're very lucky to have government support actually in the form of a PrEP app program where patients can that are not eligible for other insurance or health insurance can access health insurance exclusively for PrEP services. This includes medical visits, lab tests. It does not include the medication, but then we can use the Gilead medication assistance program or the Gilead copay program, which has also been extremely helpful to our patients. We've seen that the biggest challenge is the cliff between writing a prescription and the patient starting PrEP. And so we have significant numbers of cautionary tales of patients that came, that accessed PrEP, that got their prescription, that weren't able to fill it, and when they come back 3 or 4 or 6 months later, they test positive for HIV. And these are extremely upsetting missed opportunities. So now we have a PrEP hotline. We have a sheet that we hand out, and what I do is I have my patients take a picture of the number with their phones, because that sheet is going to get lost in 3 minutes, but hopefully the picture will remain in the phone. We have our adherence nurse that meets with patients at 2 weeks. We meet our patients a month later, and then depending on the patient, we'll set up a schedule of how often we need to meet. We do risk reduction for patients that might be out of town. We try to get our patients in to schedule them and do testing as needed. But if a patient calls us and says, hey, I'm in the other side of the country, we encourage them to go and get tested somewhere, but we will provide prescriptions, an exception, and these are exceptions that we need to do for youth. Youth, and you know, this is 18 and older. We still need to break that barrier of 18-year-old. Right now, we need parental consent for patients younger, and hopefully the laws will reflect our patients, our younger patients' ability to care for their own health, like Caitlyn mentioned. I think that's important. And again, you know, we're lucky to have support from our state government in that aspect. And so hopefully we'll continue to break those barriers and break those disparities that we're currently seeing, so that our PrEP population is truly representative of our population at large.
Thank you, Uri. Clearly, Callen, Lorde, and New York State in general, and New York City is doing amazing work. Loved hearing about the Vogue night, about mobile PrEP, about the PrEP hotline, and thank you for talking about making exceptions for youth around wait times and around helping with paperwork and around things of that nature, things that we sort of take for granted in the medical care system that need to be shifted sometimes for youth. Thank you so much for all of that. Really quickly, if you have questions, please type them into the box on the bottom right corner, or use this hashtag #PrepForYouth. With that, I'd like to hand over to Ms. Kachina Kudroff, and she will tell us about the Birmingham experience.
Yeah, so Birmingham, the South, right? It's kind of different from San Francisco and New York and Oakland. There's a lot of stigma, a lot of barriers, especially for youth when we start talking about sexual health and PrEP and HIV. So I'm lucky to be situated within a very comprehensive care HIV clinic, the 1917 clinic here in Birmingham, and we serve over 3,000 clients living with HIV in the Jefferson County and surrounding areas. But we do have some of the highest rates of HIV in the state and in the country. So really, really important not only to be focusing on that care and linkage into care, but also in PrEP. And I was very lucky to have clinic leadership behind me on this initiative. So we were really able to get that going. Just under 2 years ago, we have our 2-year anniversary coming up on Monday. So I'm very excited about that. But it was a process. So implementation, development, trying to figure out how this was going to work within a Ryan White clinic, if people were going to come, how we made it, something that would actually attract folks. And really, we kind of just had people start calling us and saying, you're an HIV clinic, you're the one in the area, tell me about PrEP. And I was luckily able to say, we're actually starting a clinic, give me a couple of months and I'll let you know. And some of our first clients were people under 29, which was really, really cool. Those numbers shifted a little bit over time, so I'd say the majority of our clients are between, say, 25 and 45, which is interesting, but 30% of our clients are under 30. So I enjoy working with them. I enjoy working with all of my clients, but as a 27-year-old, I fit a little bit more into their world sometimes. So that can be really helpful, and I think that's one of the things, too, that helps to engage youth, is really having somebody who either is around their same age or is going through the same things, or is willing to sit and come down and be with them on that level. So whether it's, okay, I know you've got a crazy school schedule, let's figure out when we can make this work, or you just need somebody to talk to about sex and nobody else will do that with you because we're in the South and sex is absolutely not something we're doing ever. So despite our high HIV rates and rates of unintended pregnancy. So it really just for them to come in and have a space where they can talk openly about sex and sexual behavior and get all the sorts of condoms they want and all the testing that they need, I think is really something that they appreciate from our clinic. Though I have to say, being in a clinical space, being in an HIV clinic does present a barrier. I know some of the other locations that are speaking are a lot more youth-friendly, a lot more youth-centric. So, for both youth and, other individuals coming into our clinic here, sometimes they're going, it's an HIV clinic, I don't know what people are going to think. A lot of stigma down here, so trying to help that be a more comfortable experience for them, really providing them with the education and stigma reduction sorts of awareness activities is something that we try to do a lot of, both in the clinic itself, but also through the SHAPE program that we mentioned earlier. So going out into the community, raising awareness not just about PrEP, but about sexual health and HIV in general to help reduce some of that stigma and increase people's access to health care. Definitely for youth who do not get any sort of good education in the school systems down here around HIV, anything like that. So it's a challenge all around. We really have to come at it, and a lot of the rest of you are doing this as well, from a very comprehensive aspect, addressing PrEP and adherence and talking to our clients, but also from the other side, just being engaged in awareness events like National Youth HIV and AIDS Awareness Day, being present on college campuses, being present in community centers, and really becoming a source of trust and respect and those sorts of things in the community. So I think, if somebody else is trying to start a program, make sure, it feels like it's there for youth. It feels like there are people there that get them. And especially in the South, make it a comfortable place where they feel like they can talk about these issues, because it's going to be hard enough for them to walk in the door in the first place. They don't want somebody who's going to sit there and say, oh, you're not using condoms? Well, why can't you be on, why are you want to be on PrEP? So just that respect and that not judgmental zone is really, really important. Thank you so much.
Thank you, Kachina, for bringing us Birmingham and the Southern perspective, which is so important in this conversation. Thank you for talking about the fact that it's important, and others have mentioned this, it's really important that staff are competent. And sometimes that means age-wise competent. And so maybe we really work to have a younger staff and we work to build up young people to be able to do this work. The fact that talking openly about sex, promoting sex positivity is kind of essential to working with youth and addressing stigma also. Thanks a lot. We are now going to go to my city, San Francisco. Adam, take it away.
All right. Thanks so much for having me, and good morning from San Francisco. It's still morning here. And happy early National Youth HIV/AIDS Awareness Day. Just a little perspective of talking about some of the youth clinics here in San Francisco in the Department of Public Health, where we're really trying to increase PrEP access to young people seen in all of our clinics across the city, so that there's no wrong door, that any clinic that a youth goes to is a PrEP clinic. And so really working with staff at each of those sites to make sure that we're up to capacity to provide those services. Just in context of San Francisco, it's a sort of an interesting experience. I think San Francisco has a reputation as being a leader on PrEP, and in many ways it is. And I think we look at the uptake of PrEP generally in this city as pretty significant since FDA approval. But I think we also know that in San Francisco, when we look who's been left behind in PrEP uptake, there are many communities that haven't had the same access, and youth are certainly one of them. And so as a city, we're really trying to focus on what youth need to access PrEP. And so that's been a challenge, but there's also been many successes, and I think what the successes are just echoing a lot of what everyone else has already said about youth-friendly services that provide whole person care around case management, mental health services, access to housing, some of the structural factors that lead to increased risk of HIV, and barriers to access for medical care and medication. So I think just to frame things, it's really great that we're doing this in coordination with National Youth HIV/AIDS Awareness Day. They this year are promoting a Bill of Rights for young people about HIV care and prevention, and I think that really informs the work we all need to do, and that everyone's already spoken about. If you look at, I really encourage folks to look at it, because they have 5 articles that sort of talk about all the needs of young people, both living with HIV and to prevent HIV, and talk about freedom from oppression, the right to education, the right to prevention, including PrEP, as well as treatment and care, and really talking about issues around discrimination and stigma that really do affect uptake and knowledge in the community. I think just to give a little perspective about what have been facilitators for PrEP expansion in our youth clinics are some things that are maybe unique to California. One, our minor consent law in California was updated in 2012 to include a clause that says youth 12 and older may consent for care related to the prevention of a sexually transmitted infection, and that was passed with, among other things, with PrEP in mind. So youth in California can consent for PrEP without parental notification and actually have strong privacy protections around that. So if you're in California, take that back to your clinics and your organizations to know that you can build on that. If you're outside of California, take that to your advocacy groups as a way to, look at influencing your state minor consent laws. We also have pretty significant confidentiality protections for youth who might be on someone else's insurance, including parental insurance, where they can suppress all confidential communication so that it won't go back to their parents. Again, that's something, if you're in California, look into that. We can probably post a resource, myhealthmyinfo.org. But again, that's a model that other states can look into as well. I think just to wrap up, so we have plenty of time to learn from Malaysia and Alexander, to just talk about our experience of our clinics are run in partnership with youth-serving nonprofits. So Larkin Street Youth Services, Huckleberry Youth Programs, 3rd Street Youth Center, Homeless Youth Alliance. These are agencies that are doing amazing work, engaging young people where they're at, providing them health education, mental health services, housing, case management. And that's really where we see where we have the window and the opening for introducing PrEP into sort of a comprehensive picture of what sexual health and wellness looks like for a young person. And so I would say as a recommendation, just really utilize your community partners who are fabulous youth serving organizations who are meeting youth right where they're at, whether it's on the street, in the shelter, at schools, because that's where I think we've seen a lot of ability to increase PrEP knowledge and access as well. So thank you for having me. I'm really looking forward to hearing from Malaysia and Alexander as well.
Awesome. Thank you, Adam, for repping the SFC. I want to really point out one thing that Adam said, which is acknowledging the inequities, the disparities that are occurring in your jurisdiction is a great way to begin the conversation around providing PrEP for youth, young people of color especially. California is clearly leading the way around minor consent laws, so there's something to be learned from that. And the article that Adam mentioned, I'll make sure to post a link to that on our resource list. With that, I'd like to hand over and ask a couple questions of Malaysia and Alexander. Malaysia and Alexander, welcome. And the first question that I'd really love for you to answer, or to give us your ideas on, is what do you like about your PrEP program and what aspects of it engage you the most? What parts of it really work the best for you? Maybe we'll start with Malaysia?
Yeah. What I like about PrEP is that it's free, and that is a pill that that's something new for the youth, and to get to know more about it and be a part of it is a good thing. And the aspects, I would say, as far as me, at 9 o'clock every day, I say I know that it's going to be every morning and stuff like that. But it's just good to have for me and for everyone that wants to get involved in it.
Oh, thank you. Thank you for that. Alexander, do you want to share your thoughts on that?
Yes, I think that PrEP is really important because the youth needs to feel more involved with the medical world. I feel like, as we're growing up, we kind of just leave everything to our parents to, figure out about our health, and I think that it's time that we start taking action for ourselves about what we're doing with our bodies. And I feel like, PrEP, a lot of concerns I've heard is that, PrEP for the youth and those under 18 is like promoting or advocating for sex under the age of 18, and I feel like the more pragmatic way to go about things is to acknowledge that we are actually being sexually active much earlier than many would like for us to be. So we should just take action, and we should, like, the fact that I didn't know until about September that there was a pill that could reduce my HIV, that could prevent me from I'm not articulating that right. That could prevent and reduce the risk of my becoming HIV positive by 90%. I feel like that is a huge deal, and that should be promoted everywhere. And it's just kind of a silent movement that's happening right now, and I guess I'm confused about it.
All right, thank you for that. And it's a shame that it took a long time for you to hear about it, and many others have still not heard about it. Malaysia, we kind of don't see half of you, so could you move a little bit more into the screen so we could see your fabulousness all the way? The other question that I'd really like to ask is, what advice would you give to another youth considering using PrEP, or that's starting to use PrEP, or that's on PrEP right now? Malaysia, let's hear from you.
What advice will I give to the youth? I would say basically there is something out there that you can have for yourself as knowing your status and stuff like that. There's programs that care, as far as I know I have. Just I'm moving on.
You want to think about it some more, and we'll come right back to you?
Yes.
All right. Alexander, you got any thoughts on that?
Definitely. I feel like one thing you don't do is go on, online and looking up the side effects. You don't do that for any medication, but especially not PrEP, because there's like just so many things about so many things that aren't happening to me or any of the people that I know that are taking PrEP, and I feel like it's just really bad for the psyche. Don't do it, folks. Just don't take it and then like forget. Always place it like he spoke about storage. Always put it somewhere where you must go to that point at some point in the day, just like all the rest of your meds. Because I have the hardest time remembering to do something if I don't place it in front of my face directly. So, yeah.
Cool. Thank you. Did you think of anything you wanted to add, Malaysia?
Advice. What I thought about was you could a lot of young
Uh-oh.
and stuff like that. But I just want everybody to know there is always somewhere to go, and that we do care for us in here in Philadelphia and all these other states and stuff like that. And PrEP means a lot to me, and if I could share it with any other youth, I would. I would share it. I would share it with them and let them know more about it. Because I don't know that much about it, but I know that it's working for me and is something that you should take every day if you really want to be taking it. Because once you stop taking it, I don't know, you could start getting side effects and stuff like that. But PrEP is good for me.
Thank you for sharing that. And thank you for reminding us, for all young people out there, there is someone, like everybody on this Hangout today, that's really there to help and to make sure you access and have access to the things that you need, including PrEP. That's a great reminder. One last question. What are some pointers? This is very important, where this Hangout is being watched by people who are considering taking on this work. What are some pointers that you would give to PrEP providers, people who are already providing PrEP to young people, or people who are considering providing PrEP to young people? How can they engage youth? How can they make this work for youth? Maybe we'll start again with Malaysia.
Okay.
Or we could come right back to you. Okay. Alexander, do you have any thoughts on that?
Oh, I'm sorry, the connection went out for a second.
Do you have any thoughts on what pointers you would give to programs that are starting up nationwide and how they can engage youth best?
Definitely, of course, like marketing is everything. Unfortunately, like, the 14-year-olds and younger are also, targets for marketers, and they need more than they used to. So for us to really believe in the product and be attracted to it, we need to be a little bit more convinced. And also, I feel like those that are advocating for PrEP and things like that, they need to be more kid friendly, and that's why I enjoy our base here in Philadelphia, why I have Philadelphia Fight, because it's vibrant, it's colorful, it's there's not that cold jail-like feeling that you might get at the city clinic or something like that. And I feel like there needs to be a lot more of that, and probably some social media advocacy would be nice, because that's where we all exist right now.
Malaysia, do you agree with that? Social media and marketing is everything?
Yes, I do. And as far as going back on to the pointers, I would say that as far as in people that's opening up like new programs, as you say, and that want to be part of this new thing that's called PrEP, what I would say to them is that if they really want to help youth out, they would take more consideration in learning about this PrEP, that somebody would take the time to share and let them know about it, and knowing that we care about the youth and that they will care about the youth, and no matter if they feel alone, that there's always going to
We didn't hear the last part of what you said.
I said, as far as in people that's opening up new organizations and stuff like that, or programs, if they really care about the youth and want to know about more about PrEP, that is very important that this is being offered to youth and to anyone, and that it's just a thing that is very exciting to me and that I like, and that's very personal to me that I can have, because nobody should have to feel ashamed about their sexual life and everything. And
I'm sorry. Can I say one more thing?
Please.
And that was the other thing I was going to say. This safe space of the clinics here, and especially this one here, I feel like they are definitely helping along the numbers of PrEP, the number rise, because without that feeling of, safety net, we are all young, we're cute and stupid, and we get into risky situations all the time. So,
right.
might as just putting that up in some pretty, colors and on the wall, especially, that's, not those words, of course, but, it really helps, because it makes them feel like, oh, you understand that we're not just, wasting our lives away. We're young and reckless, and we're making it through our developmental stages as we should, and we just need a safety net, and I think PrEP can be that safety net.
Yeah. And as far as me being incarcerated for the past couple months ago, stopped giving it to me because they thought that I was positive, but I had to let them know that I'm not positive, and even if I was, that I still would be taking it. And so it's just also being on hormones at the same time, because I was taking hormones at the same time. I never got side effects from the PrEP, because the PrEP is just something normal that I can, that doesn't bother me, because I know that I take it at the same time every day, and I would never stop taking it. PrEP is very awesome for anyone that really wants to know about it. There is many programs out here in Philadelphia, as far as Amazoni, Colors, and HIVE, that provides.
Down and out.
Mm-hmm.
All right. Well, you both are amazing. What you have given us today is so valuable, I can't even put it into words. Thank you. From the bottom of my heart, thank you for sharing your time with us today. We are out of time, but we would really ask and like for people to stick around for a few more minutes as we get into some question and answer. There's really good questions here. I'd love to give the panelists a chance to answer that. And so I'm going to turn over to Shannon Weber to run our Q&A for us. And please stick around for another 5 to 10 minutes so we can do that.
Great. Thank you all. My phone has blown up. I'm getting texts. These youth are blowing me away. Adam Leonard's cute. And then on Twitter, we're having a great showing up, especially from Female Condom Coalition, who has called for advocacy around confidentiality and sensitive services for youth. So I think that's showing us some paths forward. The first question I want to take is from Lawrence Lewis, who even showed up yesterday for this Hangout. Thank you for coming back today, Lawrence. And I want to turn the question on the head, because so many of the questions were directed back to the adults on here. And I learned this, in fact, from going to Huckleberry Clinic from Adam and having my kids at that clinic. And they constantly turn around and only talk to the youth. And so as I've watched this unfold, I wondered what that would be like for us to only answer the questions from the youth. Let me pose this one to you. What are some best practices for recruiting CAB? And we'll get this also from Brian, because they have a strong CAB. But Alexander and Malaysia, if you've talked about some strategies, attractive things on the wall, being respected for the sex life that you do have. But what are some other concrete ways you know that you as a person and your voice is valued at Philadelphia Fight?
Oh, well, just my being... Oh, I'm sorry. Did you want to say something? Well, just my being here lets me know that, I can speak on behalf of those that are actually sexually active and those that feel like there is a need for things of PrEP and security blankets of that nature. And medical care and things of, it's important, and they feel it's important, and they come and they don't just treat us and throw us back into the water. They come and they treat us for the future as well. They tell us, like, this is what you should be doing, this is what you need to do, and our voices, they let us know that our voices, are mattering, and they do change how they treat people.
Yep.
Yes. And as far as in Philadelphia Fight, part of YHIVE, part of Philadelphia Fight. The clinic also here at YHIVE. We give out tokens. We have groups, different kind of groups like yoga, sexual health group, tea room for trans. We have clothing closets. You could come here and take showers and stuff like that. We have parties, fashion shows, all type of kind of stuff here. And this is a place where you could come and be yourself. You don't have to worry about who's going to say what about you or what. Even though we have our little shady moments sometimes, but we all stick as a family. We don't let things go over the board. But yeah, the clinic here is very outreaching to us, and YHIVE and all the programs in Philadelphia are very outreach to us.
Can I say one more thing?
Oh yeah.
I agree with one of his points there, that individuality is very important, and I feel like it's well advocated here for us to just be ourselves, and they're not asking us to change who we are, they're asking us to change how responsible we are about sexual health, and they're asking us to be more preventative and providing us with what we need to be more preventative with our sexual health. So yeah, I think that's important.
Yeah. Yeah. Beautiful, really, really, really beautiful and great examples. Thank you. Brian, what tips do you have to offer about CAB recruitment, and maybe if you would say something about how the CAB involvement shifted over time, because you were one of the first programs to really start doing this, and it's been my sense from watching that the CAB has become increasingly elevated and this really core part of how you function.
Definitely. So at least a part about recruitment is that, I think a common theme tonight or today was, how much agency and self-determination that the youth have in taking part of their own, sexual health care. And so why not give them a space to where they're allowed to do that, and that they're allowed to really inform providers, really inform our staff here on the direction of, how to just do that. And so I think that's really been really successful with us, and how we became so well known and so vibrant was from that youth input. And so we try to seek really young individuals who are in the community, who are really outspoken, really opinionated, and really want to take up leadership roles and have opportunities to learn more about sexual health care here. And so many of our CAB members are originals when we first started, and we've only had to really change out a few of them. And so over time, I think we are still kind of figuring out like what does the CAB mean? What does the CAB do? Because I think traditionally, a CAB only means this to like partly advise or not really have a say into the workings of the project. But I think we really wanted to flip that script and really say, these are the folks that are from the community. These are the folks that have the greatest input. So how do we best cater to the program? How do we best cater to the community that we're serving without having your input? And so I think it really gradually over time, the CAB became more and more ingrained into our programming. And so we'd ask, hey, CAB folks, what do you think about this new outreach materials? Hey, CAB, what do you think about this new approach into how we're, treating our patients and clients? And so that feedback is really, really, really invaluable to our program and our direction.
Yeah, and I've heard your CAB members say they really enjoy the education they get at your monthly meetings too. So I think that can be another key takeaway, is really looking at what is this give and take between the youth and the providers, and who's giving and who's taking and how.
Yeah.
We have a question that's come in specifically for Yuri. Can you talk about who staffs the PrEP hotline? Is it staffed live during clinic hours, or is someone able to call the hotline after hours and connect with someone?
It's our PrEP team, and so it is staffed during business hours. We do have morning, afternoon, and evening hours.
Okay.
And it's a voicemail. If nobody picks up, then people can leave a voicemail that is checked throughout the day. Multiple times. So it might not be live, it's not like a crisis line, but it is to try to address issues as fast as possible.
Okay, great. And then there's been a couple questions about access for under 18, which I'm going to group together, and I'm going to give them to two different people who have really different setups. Adam, if you would answer first, and then Kachina, if you would answer second. So the questions are about what are options for getting coverage for under 18 besides Gilead, since it's off-label? And coupled with that, how do you handle the confidentiality if the person does have insurance? And Adam did already address that some for California, but if you have some other strategies you can share. Let's go to Adam first.
Sure, yeah, I think the confidentiality and access for medication under 18 is a challenge everywhere. I think Philly Fight has really shared a lot of information on how you can use some different patient assistance programs to access PrEP. Fortunately for us in the state of California, our state Medicaid program will cover PrEP services for minors. So we have that sort of structural piece that helps publicly insured youth access PrEP. I think other than that, we really have to rely on some of these non-Gilead patient assistance programs, which require a lot of legwork, but it's totally worth it. There are limitations to those programs and their capacity, but that's one way of access. I think we all nationwide need a lot more done on increasing access to the medication for youth, which includes confidentiality. So I mean, because of our law in California that allows suppression of explanation of benefits being sent to the policyholder, we work with young people to make that privacy request before we would bill for PrEP.
Great. Tina, what thoughts do you have?
Well, so we really haven't encountered this too much. We had one individual who was 17 when he started with us, and we were very lucky. His mom was very chill about the whole thing, so we didn't really have that issue where we had to get her consent or do anything like that, because she was just totally on board with whatever was going to happen to make him safer. So that was really cool. I think, in those situations, if it were to happen again, we definitely, our social worker is fantastic, and she'd be working us through. We're able to work with a charity care program through UAB Hospital, and then, of course, like everyone else, looking at other non-Gilead options for financial assistance. But we don't have a whole lot of experience in that area right now that I can actually speak to, unfortunately.
No, that's okay. Thank you. Another question's come in about naming off some of the non-Gilead programs, and what we'll do since we're short on time. Caitlyn and then Cassie at Howard Brown in Chicago have made an awesome medication access card that we host on HIVE Online, and so Yamini will send that out to everyone who's registered for this along with the recording, so that you can get that. I'm going to have one final question to close and go back to the folks at Philly Fight and asking you. Kenneth Miller has had a whole bunch of really awesome questions come in, but one of them that really sticks out to me, which I think would be a great way to close, is how do we excite youth in this discussion when studies show that millennials are aloof to safer sexual practices, or they're also the group that may be most disconnected from the HIV/AIDS epidemic because they haven't seen the effects of it from decades ago. So the question is, how is it that we excite youth with these two pieces of disconnect?
Is that for us?
That is.
Okay.
You'll take it.
Well, I know that I was sold when I heard about the statistics going around here in Philadelphia. 1 out of 2 African-American youth having HIV, African-American male youth having HIV, it's unacceptable. So, anyone hearing about their demographic statistics, one of those.
Would include them, but like if you hear numbers that are about you,
then you're definitely going to be more concerned about the product and how you can, apply it to yourself and your life and be safer. And also seeing that you aren't the only one, and that there's no special circumstance that you are in, and seeing that this is simply a more than it should be. It should be a normal way to just be more responsible about your health, but unfortunately it's not as popular as we'd like it right now.
Do you have anything to add, Malaysia?
No, not on this one.
Not on this one. All right, that was awesome. There's more questions. I think we can do another Hangout another time and really pull apart under 18 and over 18, for example. Talk really a lot more with youth themselves about what these collateral services look like that are so attractive, and then also talk about with another group of folks what are some of these advocacy efforts that we need to get underway to really overcome some of these gaps that we're struggling with.
Thank you, Shannon. We're going to begin to wrap up here. I want to say a couple things. This video is going to live on YouTube, and it's not going anywhere. You can search it. We will provide the link for it. It's going to be on YouTube. I want to just encourage everyone to continue the conversation. Let's use the hashtag PrEP4Youth. I want to also shout out the fact that we're commemorating National Youth HIV/AIDS Awareness Day. Please use this hashtag to show your love. Hashtag NYHAAD. I want to quickly share an image that I really love that they came out with, and to again shout out and to support. With that said, I would really like to thank all of our panelists. Thank you, Adam in San Francisco. Thank you, Brian in Oakland. Thank you, Kachina in Birmingham. Thank you, Malaysia and Alexander in Philadelphia. Also, thank you, Caitlyn in Philadelphia. Thank you, Shannon in San Francisco. Thank you, Yuri in New York City. With that, I'd like to close our broadcast for today. I'm going to put up a slide, which you will be able to click on and will eventually take you to a list of resources that relate to this Hangout. This was an amazing experience. I can't wait to do it again. And have a great day. This was Hangouts with HIVE.